Okay. So everything is okay. Hello, Dr. Melillo. I'm
Hi, how you doing?
so excited to have you here. Really, it's such an honor because I'm following your work now for a couple of years and have changed mind a lot, your Dr. Melillo's method. So I work mostly with posture and breathing at kids and adults. And I also understand, thanks to you, that brain development is very important for that too.
Mm-hmm.
So I come to across to your method, and I studied a bit, or I love it very much. I have some courses. I have your great books. So I have already made an introduction to you, to our listeners. And so we can, if you agree, immediately jump to the questions.
Sure.
Okay. So we have a time limit. So I appreciate your time and
My pleasure.
jump to the first question. So all dominances, eye, ear, hand, and leg, should be on the same side of the body, preferably on the right side, right? If this is not the case, that is indication of brain immaturity. At what age can we start checking the kids, and if it's possible to correct it? Let's say we have a 9-year boy or girl or 6-year-old, and we see that all dominances are on the right side, except the eye, which is on the left side. Can we correct it when we have a kids, or with adults? I don't think so. And if it's important that kids are using the right hand, if we see that they use more left, or ambidextrous, they're ambidextrous. So what are the consequences then, if not?
Okay, well, you're exactly right. In my opinion, if there is a mixed dominance, it shows that there's some immaturity in the system. Um, all people should have somewhat of a mixed dominance until around the age of 3. So by the end of the second year, it seems to be more stable, and that's when the dominance should be able to be identified. So by 3, but what we see is that if a child has a dominance before that, like some parents may think, the child at 1 or 2 may be more right hand or left hand dominance. It's usually because there's some weakness, some neurological weakness in one of the limbs, and they may prefer one. So, before the age of 3 or 2.5, you really shouldn't see a dominance. It should more be ambidextrous. But then as the two sides of the brain really differentiate, what happens is one side of the brain should take over for the dominance profile. In most people, about 95% of people, that would most likely be the left brain, which also would be the dominant side of the brain for their language. So we just wrote a paper on this year and published it on the kind of evolution of brain asymmetry, and also the idea of evolutionarily the dominance profile. Where do we see that? Where does that come from? And what we see is that in certain animals, like what's called cetaceans, which are dolphins or whales, we see they have a phenomena that, because they're mammals, they have to constantly thermoregulate. So they need to constantly move. And they also need to breathe. So they need to surface and breathe periodically. And because of that, the question is, what happens when they sleep? And so they have developed a mechanism where one half of the brain sleeps and one half of the brain stays awake. When one half of the brain stays awake, the aware brain on the side opposite, their eye or their hearing or their motoric capacity stays on. So that's why the idea of sleeping with one eye open, and certain animals do this. So we can see that that's kind of the precursor of the dominance profile. It also shows us that sometimes the brain will switch in, what's awake or what's aware and what's unaware. And in humans, the left side of the brain, or the language side of the brain, is usually the more conscious, aware side of the brain. We're more aware of what we're doing. We form conscious memories with that side of the brain. Whereas the right side of the brain in most people is more the subconscious brain. This forms first and takes the lead in development in the first 3 years. And it forms more subconscious memories. That's why most humans have what we call childhood amnesia. We don't remember the first 3 years of life. And so all of this is connected. And as the two sides of the brain mature and as they become more specialized, the one side of the brain, the aware side of the brain, should control the dominance for the eye and the ear and the hand and the foot on the opposite side. So
yes, first 3 years is more dominant right hemisphere, right?
First 2 to 3 years.
But we should develop these dominances on the right side also. This is something strange.
Well, because the first 2 to 3 years is the right brain forming, when the left brain comes online at 3 years is when you should develop the dominance profile. Mm-hmm. So it makes sense from that standpoint that, the right side controls the left in most motor activities and vice versa. But when we look at, which is dominant, and which we're more aware of, it's the left brain should control that, as well as should control language and the formation of conscious memories as well.
Could we have all dominances on the same side, and also brain dominance on the same side? Is this possible?
Yes. So when we talk about brain dominance, the dominance profile is really more for, the conscious control or the volitional control of that. But when we talk about, whether somebody is more of a left brain dominant person or a right brain dominant person, you can have a right brain dominant personality. So when we talk about cognitive style, the way the person thinks, the way they view the world, the kind of schema they use, we find that, I think it's about a 50-50 distribution, is that some people view the world more through the right brain and some people view it more through the left brain. Now, either way, you can have a right brain dominant person, but they have a left brain dominance profile. So it can be confusing when you're just using the words. But when we talk about a dominance profile, we're talking about, dominant eye, ear. But when we talk about really cognitive style and whether we're a right brain or left brain dominant person, so to answer your question, you could be right side dominant for eye, ear, hand, and also be right brain dominant cognitively.
Okay, it's possible. Okay, go on. I had a client, a mom with a 3-year-old boy who can read at this age, and mom was very proud of that. But then I said that probably could be also negative sign, because the brain is maybe lateralizing too quickly, and the one side is, like you say, undercooked than the other. And also we know that left side of the brain is the reading part, the right side is the comprehension of the reading, right? So could be that the early sign of the autism spectrum or something else?
Yes. So there's something called hyperlexia. And hyperlexia is typically where we see children who can read or kind of teach themselves to read before the age of 2. Again, the left brain shouldn't really fully come online until 3. And then it takes, another 2 to 3 years to develop. So most people, if their language is in the left side of the brain, that's going to be the primary side of the brain for reading as well. And most people shouldn't be reading, before the age of 4, probably. and maybe even not till 5 and 6. I know a lot of European countries, they don't even start teaching kids how to read until around 6 years of age. So that's probably right, and that is when it really should be coming online. If you have a child that is reading, before the age of 3 or at 3, then it might be related to what we call hyperlexia, which that's what we see quite often in autism spectrum. And the reason for that is that what we see is that kids on the autism spectrum typically come from families that are very gifted in their left brain and tend to be more left brain dominant and highly intelligent. And what we see is that they end up with right hemisphere delays. So as they're developing, I believe that because they have in part retained primitive reflexes that are supposed to go away at 1, if they don't go away at 1, if they don't become integrated, that holds the brain back, and the right brain is forming first in the first 3 years. So the brain is kind of delayed now, and it's being held back, and the right brain is being held back more. And if they're gifted in the left brain and it breaks through too early, so the left brain comes online too early, and that is what we see in autism spectrum, and then that left brain further inhibits the right brain, and this sets up that developmental imbalance that I believe is actually the core problem in most neurobehavioral disorders, but especially in something like autism. And so, that's why I don't really even agree. There's a lot of techniques or people out there that talk about, trying to get babies at 1 or 2 to read with flashcards. That shouldn't be the focus of the first 3 years of life. It should be more about moving and exploring their body and, becoming connected physically to their body and being able to connect to other people and learn how to read other people in social situations. And then when the left brain comes online, then they should be able to read. Now, the answer is that obviously in some instances, you may get a child that's just very, very bright, and that when their left brain comes immediately online, they're able to read, and they might be unusually gifted, and it might not be abnormal. It might not be, but the way you would know that is if there are still retained primitive reflexes. If there are retained primitive reflexes, and if they may have a mixed dominance profile, then we know that something may not be going in the best way, and that this may be something negative. And what we often see in kids like that is even though they read early, when they get later on in life, they have trouble with reading comprehension. So even though they're early readers, they don't really comprehend what they're reading. And many of them end up not really liking reading because of that.
So the problem is this not integrated primitive reflexes and mixed dominances. I forgot to ask you, so what can we do about the mixed dominances at kids? Is there a part of integrating reflexes and integrating the brain hemispheres, or is something else to do?
Yeah, in general, we check this on every patient. So we've checked this on thousands and thousands of people. And, more commonly in the patients that we work with, whether they're children or adults, they end up having mixed dominance. And we know that the literature says that mixed dominance is more common in people that are gifted and in also people that are disabled. So I believe that it's really a reflection of this type of imbalance that we see, where we see people that may be unusually gifted in certain areas, but they're also really struggle in other areas, and they have this developmental imbalance. And so what we're doing is we're trying to determine which side of the brain do they have a deficit on. So this is another terminology. One, we talk about, a dominance profile of hand, eye, ear, and foot. But then we talk about, a hemispheric dominance or a cognitive style dominance, the way we think and whether we're more of a right brain or left brain dominant person. And then we also need to look at, do they have a deficit? So being right-handed or left-handed, that's pretty normal. Mixed dominance is not. Being more right brain dominant or more left brain dominant, again, is normal. I mean, everybody, I think, is one way or the other more to varying degrees. But whether you have a deficit on one side, where you have this imbalance, where there's too much of a deficit, that is where it produces symptoms, and that's where it produces problems. So what we do is focus on where is there and where is the hemispheric deficit, where is the symptoms are caused by overactivity of certain networks or areas on one side, and underdevelopment and underactivity of areas on the other side. The combination is almost limitless, but the combination of overactivity, like something like tics or stims or anger outbursts, or kids that have phenomenal memory for things. And then you may have other, on the right side, there may be a delay in nonverbal communication or socialization or interoception or being able to, comprehend what you read. So what we see is that there is this deficit, and what we're doing is try to correct that imbalance. We try to determine, is the person more naturally right brain or left brain dominant? Most people will end up with a deficit if in childhood, opposite of the side they're dominant. So if they're naturally a dominant, left brain dominant person, if they come from a left brain dominant family, they are more likely to have a right brain delay and end up with an imbalance and see a right brain delay, something like ADHD or autism or OCD or tics or Tourette's or schizophrenia, something like that. If you have people that are more right brain dominant and have a family and come from a family where we have right brain dominant people, they're more likely to have a left brain deficit. So they may be more likely to have something like dyslexia or a learning disability or processing disorders or depression or bipolar, or, rejection sensitivity dysphoria or anxiety. So
you call these natural traits or something like that, or are these genes?
Well, they're genetic traits, but they're traits, right? Just like, your height is a trait, your hair color, your eye color is a trait. Being right hand or left brain hand dominant is a trait that you get pretty much from your family. Mm-hmm. And being more right brain or left brain dominant in your cognitive style is also, I believe, a family trait, right? We know that you can have a family of people that are all, artists, or a family that are all musicians, or you can get Simon Baron Cohen out of Cambridge has shown in the family of people with autism that there's much more of people that are mathematicians or engineers or physicists or people that tend to work in the IT industry. So that's what we see more with left brain dominant people. So these are natural traits. They're not genetic mutations, but they are built on genes. But there's nothing abnormal about it.
Okay. So this is the Melillo method to try to solve this.
Right.
Primitive reflexes, left, right, hemisphere integration. Okay, and we have also maybe other methods on the world which deals with that, not in the same way. But I was thinking, how could the sound vibration therapy, like Tibetan singing bowls, regulate the nervous system to regulate left and right brain, if is there a delay, and regulate the sympathicus, parasympathicus. I also have one here, which I use a lot lately, and I realize how it calms my brain. Also, I have a little bit anxious brain, maybe also adult ADHD, something like that. And I saw how these low vibrations, like 100, 200 hertz, is helping to my, I think, right brain.
Right.
So, yes. So then when I was searching, Googling, stuff like that, I find many articles also talking about, let's say, Tibetan singing bowl therapy, helping kids with autism and ADHD. Then I found many binaural beats on YouTube or frequencies. like 432 hertz and 528 hertz, claiming that help the body, the brain. And also I found one of your articles also talking about, among other things, the Mozart music helping. And then is also Stephen Porges and his safe and sound protocols with these prosodic sounds helping to mature the new vagus nerve and so on. So what do you think of the singing bowls and other sound vibration modalities to regulate the brain?
Yeah. So again, go back and answer your previous question, by the way. We don't usually try to change dominance profile, but we do find as we get the brain to mature and as we correct the imbalance that most of the time it will correct itself. Okay. But after the age of 10, we may not be able to change like hand dominance because someone just becomes used to that. But essentially, when we talk about imbalances in the brain or when we talk about what's happening, it really comes down to looking at brainwave frequencies in different networks, right? That's essentially what we're talking about. We're talking about that we have different networks in the brain, like things like the salience network or the default mode network or the central executive network or the frontal parietal network, the limbic network, the sensory motor network. So we have these major networks in the brain, and they're different from the left side to the right side of the brain. And they will oscillate at certain frequencies. So we see that there are frequency bands that generally go from 0 to up to about 100 hertz in the brain. And, we start out with low frequency like delta, and then theta, alpha, beta, high beta, gamma. Gamma typically is around the highest, and then we even have high gamma. So what we see is that there's a developmental trajectory to that, meaning that when we start out and we're young children, typically between the ages of 0 and 2, the dominant rhythm in our brain is more delta. So in most adults, we would only have the majority of delta when we sleep, when we're in very deep REM sleep. Babies sleep most of the time, and their brain is mostly in a delta state. They have other brain waves, but primarily that's the dominant rhythm. Then when they get to around 3 to 5, it seems that the dominant rhythm is more around theta. And theta is also in adults would be when we're more kind of drowsy, starting to fall asleep, or, it also is related to memory. So children between the age of 3 to 5 are like little sponges. They remember everything. But they still may nap, during the day and still may get tired easily. And then around the age of 6 to around 12, we're going into a dominant alpha rhythm. And most adults stay at an alpha rhythm of around 10 hertz for most of their life in the back of the brain, a little bit more on the right than the left. But then we also have beta, which are higher frequencies. Those are, alpha is between 8 to 12. Beta is really between like 13 and 40 is really where we're looking at beta rhythms. And that comes on a little bit more as we get older in teenage years. And then the gamma rhythm comes on. And the gamma is really from 40 to 60. High gamma is like above 60. And this regulates how we talk. So for networks in different areas of the brain and in different sides of the brain to communicate, they need to be on the same frequency band. So if we have a network like the salience network on the right and the left needs to, let's say, oscillate at a beta frequency to be able to communicate. If you have different networks on different sides of the brain that are on different frequency bands, they can't communicate with each other. I use the analogy, it's like if we have a group of people on a walkie-talkie and they're all on the same frequency band and they can talk to one another. And then you have another group that's on that all have walkie-talkies and they're on a different frequency band. They can talk to one another, but the two groups can't talk to one another because they're on different frequency bands. And this is really the imbalance. This is what we're talking. So anything that changes frequencies in the brain and causes resonance can change the way a network is oscillating and communicating. So sound, obviously we have different vibrations, we have different frequencies of vibration, and that sound vibration can change the frequency of how the brain is oscillating. If we have a higher frequency sound, it is more going to make the brain in the hearing areas of the brain oscillate at a higher frequency. If we use a lower frequency, we may do that. But we have different receptors that are sensitive, and the two sides of the brain are different in their sensitivity. So the left side of the brain is more seeking out or more aware of higher frequency sounds, and the right brain more responds to low frequency sounds. So as you're saying, if you're using a low frequency tone or things like Gregorian chanting, and things that don't involve words, or things that might be more negative or more, potentially dangerous, these are things that activate the right brain. This is why Stephen Porges talks about, using lower frequency sounds or things like that, because that is something that activates the right side of the brain. I believe the right side of the brain is more related to the parasympathetic nervous system or the vagal system. And that is also the side of the brain that pays attention and that also helps us to calm down and relax, and get out of that fight or flight state. So whether we use different colors of lights, we use different vibration frequency, we use different sound and music and tones, we use different frequencies of movement, we use different frequencies of flashing light or other things. Smell generates different smells, generate different frequencies in our smell networks. So almost everything we do involves using frequencies. But what we need to do is know what frequency we're using. And the thing that we don't know a lot of is when we're talking about using certain frequencies like solfeggio or other frequencies, there isn't a lot of research on how those frequencies actually impact the brain. We know about the basic brainwave frequencies, and we know that we can change those, like even using, like we use laser or red light or infrared light. We're about to start a research project where we believe that using that will change brainwave frequencies, but that's not really been proven clearly yet. So there's a lot of people that claim a lot of things about frequencies, and it may be true or it may not be, but most of it is not based on very good research.
Okay, very interesting. I love vibrations, sounds. Okay, go on. So we know that left brain. Okay, I will put the question first. Can the brain development, proper or improper, affect the tongue posture and proper development of swallowing and the jaw? We know if the kids have this disbalance, we said of the right hemisphere, where they have maybe chronic ear infections or throat infections. Maybe they have more problems with also inserting these ear tubes in Eustachi tubes, and could be this also the problem. They also don't hear well then, and could affect then the all this oral myofunctional development. But there is also other doctors like dentist Dr. Ben Miralia of holistic dentist of Airhead Air Solution. He claims that this chronic ear infection and these problems come mostly from the incorrect tongue posture, because underdeveloped of the jaw, because improper food, too soft food, and so on. So the tongue doesn't go to the roof of the mouth with the correct deglutition, when the tongue has to go backwards. So when the tongue goes backwards, it creates a vacuum on the palate and also drain the liquid from the eustachian tubes. So then they are clean and the kids don't have the ear infection. So maybe it's all together. So from your point of view, how brain development affects this development and these problems? Also occlusion at the end.
Right. I mean, I look at, with me, it really always starts with, the postural system first. When I'm talking about brain development or teaching doctors or therapists to look at brain development, I teach them to look at it based on the way that the brain and the body develop. And for me, I look at the whole thing integrated together, the whole system. I just don't look at one thing like what's happening in the jaw. I look at the jaw as part of the whole system, and the mouth and the tongue and all of it. So, we start out first, again, with primitive reflexes. So these primitive reflexes are there. And one of the things we know is that when we're looking at infants early on, the earliest sign that there's a problem is really looking at tone and symmetry, or in general, their muscle tone. But to me, one of the first problems we see with kids is when they can't latch on during breastfeeding from the beginning. If a baby has a problem within the first few days to weeks to latch on, it usually signifies that there's low tone in the mouth and around the mouth and the tongue. Some of it may be related to things like tongue ties or lip ties, but more commonly, they have an alteration of tone from the beginning, which means their brain is not developing right or properly at that point. And so that is connected to the rest of the posture. We also see that these kids tend to be more floppy. They tend to be delayed in when they roll over. They may not roll over properly. They may, then be delayed in the way that they belly crawl, or they may not belly crawl, or they may be delayed in crawling or do it in an abnormal way, or skip it altogether, or, and then they may be delayed in when they're going to walk and stand up and walk, and then they may be delayed in speech. So the way I look at it is the first thing that develops is tone, and especially the midline tone that involves the spine first and foremost. The neck and the spine is really the foundation of tone in general and movement. And then the midline muscles of the mouth and the tongue and the jaw are connected. And then built on top of that, we have the vestibular system, the inner ear, then is built. And that's also very online early on. And then we have the oculomotor system, the eye muscles. So our postural motor system is the foundation of tone. And if we have imbalances, we see that kids have head tilt early on, or they have facial asymmetry early on, or they have low tone around their mouth. And then they usually have imbalances in their vestibular system. And they then may have, a lazy eye, or their eyes don't work or aren't lined up properly. And then they usually end up having imbalances in their cerebellum and their brain. All of that needs to connect. And so we do see that kids that have, retained reflexes or altered reflexes, that early on, they may not be developing the proper tone or proper control. If those reflexes around the mouth, like the rooting and sucking and snout reflexes, if they don't go away, then their brain, those muscles aren't maturing. The control of those muscles won't proceed. And all of this really has to do with maturity in the brainstem. So we look at the areas of the brainstem where the reflexes come from. Most of them is in the lower part, what we call the pons and the medulla. Mm-hmm. This is also where the cranial nerves that control the inner ear, the mouth, the tongue, swallowing. And so that's the same area where that those cranial nerves that control the muscle tone come from. So
is this called PMRF?
The pontine medullary reticular formation is part of that, right? Yeah, that's part of that. Is that area is an area that is very important for muscle tone in general. But ultimately, the brain is supposed to create tone. So tone really comes from the brain. It initiates from the brainstem, from different brainstem pathways like the reticulospinal tract or the vestibulospinal tract. And so all of this is developing. And if you have poor postural tone, if the baby can't roll over, if they're not able to control their head, and they may have forward head posture, they may have a head tilt. This is obviously going to affect them, is going to also be related to the mouth and the jaw. And it also may be related to the skull bones and how they come together or move or don't move. And then that can affect, mouth breathing, and that can affect the way the jaw develops and the facial muscles. And that may also, play a role on the eustachian tubes and, again, where the tongue sits in the mouth. But to me, it's all neurological. It all starts with the development of the nervous system and development of tone and development of the proper symmetry of tone from the beginning and how those systems proceed. So if a child misses milestones, or they start off early where they can't latch on, or they don't roll over properly, already there's a problem, and we really need to intervene there. And if we don't, it can cause a whole series of different issues.
But this low tone of these orofacial muscles is more the problem of right brain delay, or both? Problem of the both hemispheres?
It really starts out more with the brainstem itself, because really the cranial nerves and the muscles that control that. But the muscles that control the face and the mouth and the tongue, cranial nerves, what we call cranial nerves 5, 7, 9, 10, and 11, these are all the cranial nerves that Stephen Porges talks about as the branchial arch cranial nerves. And they are all related to the parasympathetic nervous system and the development of what we call the nucleus ambiguus in the medulla. So if we have low tone around the mouth or the face, or we have facial asymmetry, it usually means that the brainstem and the medulla is not maturing. And that is often because there are retained primitive reflexes in that area. And if those reflexes don't go away, that area of the brain doesn't mature, and it affects the muscles of the face and tongue and mouth and jaw, and can affect things like speech or swallowing or chewing or breathing or vocalization. But it also affects what we call social engagement. So the ability to recognize facial expression on others. And all of that is developing primarily during the time of the right brain, right? That's when the right brain is more active and more developed.
The ventral vagus is developing here.
Yeah.
What you're talking about.
Within that first year is when that ventral vagus system.
And if you have retained fear paralysis reflex, then this goes wrong. This parasympathicus and this development.
Right. We often see that many of the kids that are most delayed, like non-speaking autistic kids, often still have the fear paralysis reflex is still there. And they can be very resistant to any sort of type of treatment or intervention or interaction. Later on in life, it can be more present in adults and be more related to a freeze response, and is often associated with things like, psychological trauma, post-traumatic stress disorder, and things of that nature, where you may get also something called POTS, where there's, overactivity of the parasympathetic nervous system or oversensitivity of that, where people, when they're afraid, they feel like they freeze, or they may feel like they're going to faint or pass out.
This vasovagal syncope, is that?
Exactly.
But can we have both non-integrated fear paralysis and Moro reflex? They seem to be similar, but also contrary each to other.
Yes, that's a good point.
I don't know how to test one or another because many courses, it's all together, also
Yeah.
fear paralysis, Moro reflex.
Yeah, I have a lot of people. So the fear paralysis reflex should really come online first. And that is more the older dorsal vagal system, the dorsal motor vagal nucleus in the medulla. And then the Moro reflex should come on later on. And that is more the sympathetic nervous system that governs what we call the rostroventral lateral medullary nucleus in the medulla as well. And that is more online, and that should inhibit the fear paralysis reflex somewhat. And the Moro is more the sympathetic nervous system. And so when a baby is born, they should be more in a sympathetically dominant state. And then over the course of the first year, the nucleus ambiguous or the ventral vagus should come online so that by the end of the first year, it should be fully developed and mature. And then that will inhibit the Moro reflex and the sympathetic nervous system. And ultimately, that's when the brain also comes down and should inhibit and integrate all of the reflexes and really, start to control how all of these nuclei work together and the balance of the parasympathetic and sympathetic nervous system and the immune system and all of those things. So, you can see how this is all interrelated, right? Because we're talking about the facial muscles and the jaw. Ultimately, the tone of that really comes under control of the nucleus ambiguous. This is also related to getting rid of the primitive reflexes, which is related to movement and how the baby moves and the quality of the movement from coming out of the womb and through the first year of life, and the development of the postural muscle tone, and then the vestibular system and the oculomotor system, and ultimately the cerebellum and the brainstem, and then ultimately the brain. And the brain builds from the bottom up, and then it comes from the top down and is supposed to regulate everything and integrate all the reflexes. And so anything that deviates from that can create imbalances. And then those imbalances, once they're in place, they don't self-correct. We need to do something to change it and correct it. And we can do that at any point later on in life.
So we can have both non-integrated.
Absolutely.
Yes.
Yeah.
And we can also, can we have also both, let's say, ADHD and dyslexia at the same time? Because
yes, we can. One of them is more typically a right brain delay. Yes. With overactivity of the left, which traditional ADHD, especially type 2 and type 3, are really more, right brain deficits. And then you have dyslexia, which is a left brain deficit. So the symptoms involve, you can have imbalances on either side, and that's superimposed on your natural strengths, but it's also superimposed on, the way that you move through the world initially and all of those things. But we can change either one of those situations at any point in time in life. The earlier, the better.
So one can have both disbalances at the same time.
Well, you don't usually get a left brain deficit and a right brain deficit at the same time. We may have, if all the reflexes are there, the whole brain may be immature. So we may have somewhat delays on both sides, but there's usually more of a deficit on one side and the other side is relatively more active. Yes. We may get where one side of the brain is very delayed and immature for the age, and the other side is actually very advanced. I mean, we have some kids that can be 5 years ahead with their left brain skills and 5 years below their actual age with their right brain skills. So, there's varying degrees of that.
Epilepsy and Melillo method. Can you cure the epilepsy?
There's many different causes of epilepsy, right? There are genetic disorders, genetic mutations. There are metabolic issues. There are, toxicity issues. But in general, what we see is as the brain is immature, you may have more of a tendency for it to misfire. We do a lot of EEGs on people, and we see a lot of what we call paroxysmal activity. it's not really fully seizure activity, but it's also kind of like little glitches. It's not epilepsy, but it's almost like seizures. And what we what we do find is that in most of the people we do EEGs on, we see that on one side or the other. We also see that when we retest them, that it often, the majority of the time, goes away. So, we know that I believe what we're doing is changing the efficiency of the brain and the maturity and the way that it's firing and the synchrony. And we know that, when we look at some seizures, there's really a problem with synchronization. And I believe that relates in part to maturity and coordination. And so if those are related and we can change the brain, then we do see some people that, that note that their seizures have gotten better or gone away.
Okay. Can IVF, in vitro fertilization, affect the brain development?
I'm sorry, say that again. What?
IVF, in vitro fertilization, can affect then the brain development of the baby.
Yeah, what we see is that, there are a number of, pre and perinatal factors that may affect brain development. We're not really sure, but we do know that, my third book, I talked about what are the risk factors that lead to higher percentage of risk of having a child with a developmental disability and therefore some sort of abnormal brain development. And, in IVF is one of those factors that, we see that people that have had IVF, they may be more at risk for having a child with a disability, but we don't know why that is, right? Is whether it's having the IVF itself or whatever the difficulty is that's causing why they need the IVF, what's happening in their body. We do know that the older an individual is, mothers over the age of 35 and fathers over the age of 40, there's a significant increased risk in having a child with a disability. And so if people find that, they're going through IVF because they're older parents, so it may not be the IVF, it may be that they're older. We know that is a risk factor, but, it's we can't say that the IVF itself is affecting brain development because I'm not aware of research that shows that at this point.
Okay. We know that the eyes are windows to the brain. Which of the eyes movement, from your perspective, is the most important to see the brain imbalance, like smooth pursuit or convergence or fixation-accomodation?
The way, again, when we look at the way that the eyes develop and the oculomotor system develops, like most systems, it starts with reflexes. And there's something called an optokinetic reflex. Mm-hmm. This is a natural reflex that if we put, like rotate, like something like this, like streaming like this, or if we had something that looked at, stripes going back and forth like this, and if I put that in front of somebody and they look at it, their eyes will automatically jump. If I go up and down, they will bounce up and down. And we don't even realize this is happening. And this is really there from almost the very beginning of when a child is born. That optokinetic response is really the first kind of foundational visual system. And it's more of what we call a motion detection system. And that develops through what we call the dorsal stream. And that develops in the right side of the brain more. And it is more related to the peripheral field of vision and really seeing more shades of gray, not really clear vision and not really color vision, but really more movement vision. And that is the type of vision that develops first, so that we develop kind of this big picture image of the world. Then after, when the left brain comes online, we start to develop what's called the ventral stream. And we have the fovea of our eye, which has central field of vision and has many more receptors, especially the cones, and we see much higher detail. And then we develop what we call smooth pursuit movement, where we can slowly track things. And then we can develop, what we call saccades, voluntary saccades, where we have fast movement. And then we can have control over our eye movements. And we have an area of the brain called Brodmann Area 8, which is the frontal eye field, which ultimately controls our eye movements and the control of voluntary control of eyes. So it's really a system that develops like that. So it's not that one type of movement is more important than the other. It is that they should really kind of build on top of one another. And it all should start with this optokinetic response. So the first thing I look at is to see, is that optokinetic reflex, is it equal in all directions? Or do we see it deficient, going to one side and maybe more active to the opposite side? If we have imbalances, if we're not, or is there a delay of that where it really doesn't work very well at all? And that we can see in the beginning of imbalances, and that's one of the first things we work with, because in small children we're not going to get them to do eye exercises, but we can do this thing reflexively that can work on their visual system.
Great. Can I have just one more question?
Okay.
What are the nerve pathways of retained spinal galant reflex of the children older than 5 years old that make the kids bedwetting? What are why the spinal galant reflex can cause non-integrated can cause bedwetting? What are the nerve pathways?
Yeah, as far as when we look at the ability to inhibit bedwetting, we know that is a maturational process as our brain matures, and it seems to be controlled more by the right side of the brain. And again, the right side of the brain really starts out, especially with those midline muscles, and is very connected to the spine and the postural system. And so I believe that the relationship there really has to do with the development of the spine and the postural system, which is the spinal galant, and the maturity of the brain, especially the right side of the brain, and the ability to inhibit, and especially the activation of the parasympathetic nervous system, so that there's areas of the brain that control what we call micturition and will inhibit that. So, as far as the pathways that inhibit going to the bathroom at night, there are specific parts of the brain and the brainstem that regulate that. Descendingly, it's mostly through the reticulospinal tract, through some of those autonomic fibers that go down, that activate sympathetic and parasympathetic nervous systems. But it really is a byproduct of maturation. And there seems to be a relationship between the spinal galant and that system. But again, all primitive reflexes can play a role in immaturity of the brain and therefore persistent bedwetting. Mm-hmm. It's not just that one reflex. Any retained reflex may interfere with a child and may relate to bedwetting, even though the spinal galant seems to be maybe the most connected.
What about urge incontinence in adults, in women? Does also something to do with that, or the brain disbalance?
It can. I mean, I think, I've seen a lot of adults that still have retained primitive reflexes fully, and that may, affect their bowel movements or their bladder control later on. Again, the balance of the sympathetic and parasympathetic nervous system plays a big role in that, because ultimately the control of the sphincters really comes down to looking at that balance of sympathetic and parasympathetic tone.
So everything is neurology, right?
I tend to look at it that way, that everything really comes down to the brain and the nervous system, and looking at development of the brain and the nervous system.
Okay. Do we have to finish? Or?
Yeah.
Yes.
Yes.
Okay, Dr. Miller, thank you so much for this conversation. It was very informative. I hope someday we can hear or meet again in person. So happy to know you. I will spread the word in Slovenia and broader if possible. So thank you very much. Have a great Christmas holiday with your lovely rounds.
Okay, and do you know Dr. Tina, by the way?
Yes, yes, I know. I know.
Okay.
Yes,
All right.
yes.
She's been a
Okay.
student of mine for a long
Okay.
time, and she's really
I
great.
I will, yes, I will talk about her also, and parents can also reach you
Yes.
online.
Yes.
Okay, can
Okay.
meet appointment, everything. Can buy the books, or you have one great online course also for adults.
Yes.
And I think it's great when parents know themselves as well, their problem
Mhm.
with maybe unbalanced brain. Also, I think I have a little bit of this balance. So if you want to help your kid, you have firstly to help yourself and understand your
Yeah.
brain.
Yep.
So you have this great course for adults. It's very simple, and I will put the link also for
Yes.
that. I think it's very
Okay.
interesting for the parents.
Yep. That's
Okay.
wonderful. Okay. Thank you very much. I appreciate
Okay.
it.
Thank you very
All right.
much.
Bye.
Greetings from Slovenia. Bye. Thank you.